Hello, this is Dr. Grande. Welcome to my video on psychoanalytic therapy. I'm going to start off looking at psychoanalytic therapy by taking a look at the theory of personality behind this modality. Sigmund Freud divided the personality into three structures: the id, the ego, and the superego. So first we have the id. The id represents unconscious needs or wants, and this structure is the only structure of these three that's present at birth. So according to Freud, the id exists as long as a person exists. The id seeks immediate gratification, and it does so in an effort to reduce or avoid tension. Next we have the ego, and the ego balances the demands of real life and the demands of the id. And later on in this balancing, it includes the superego. The ego develops at about 6 months. The ego is capable of deferring gratification. Then we have the superego. And the superego is the part of the personality that internalizes societal morals, rules, standards, and values. And it develops at about 5 years of age. Now the ego works to defer gratification, as I mentioned, but the superego operates a little differently. It works to block those drives that the id has that are not acceptable to society. So Freud believed that anxiety was produced by conflicts between these drives from the id and the constraints of reality or the superego. And in instances when the ego was not capable of resolving the conflict, defense mechanisms would be used. So let's take a look at those. So you can see here I have 11 of the defense mechanisms, but there are several more. But these are among the more popular defense mechanisms. First we have acting out, and this one is fairly straightforward. This is the performance of an extreme behavior in order to express thoughts or feelings instead of verbalizing those thoughts or feelings. So an example might be if somebody hits an inanimate object or throws an object across the room instead of expressing verbally a feeling of anger. Denial is also fairly straightforward. It's simply the refusal to accept reality. And oftentimes this reality is a painful situation or a painful event. Displacement deals with the redirection of thoughts and feelings. So with displacement, an individual may have specific thoughts or feelings, oftentimes they're negative, about a person that has power over them. For example, an older sibling. And they want to react to the thoughts or feelings. The individual wants to react to the thoughts or feelings and target, in this case, the older sibling, but they can't because they're afraid of the reaction. So they displace those feelings and take them out on, say, a younger sibling who would be more vulnerable and less likely to be able to retaliate. Compensation is when an individual has perceived weaknesses, and they look to overcome these perceived weaknesses by focusing on strengths they have. Now, it's not unusual to think of compensation as a good thing, and it certainly can be, but keep in mind when thinking about psychoanalytic therapy that Freud believed that overdependence on any defense mechanism was likely to cause dysfunction. Oftentimes in counseling, when we refer to compensation, we're really not referring to the defense mechanism, but a healthier type of compensation where the client has insight and they're aware of weaknesses and they compensate by focusing on strengths. In the defense mechanism version of compensation, the mechanism is still preventing a resolution to the conflict. Dissociation is a defense mechanism where an individual loses track of who they are as a person, feel disconnected from reality, or they are no longer aware of time. You can think of dissociation as a disconnection from the real world, temporarily. Dissociation is often associated with childhood abuse. The next defense mechanism is fixation. And to understand fixation, you have to understand the psychosexual stages that were proposed by Freud. And I'll be covering those stages in the next slide. But what fixation is when an individual gets stuck or remains on a particular stage of development. Rationalization is when an individual explains behaviors that may not be socially appropriate or acceptable in a logical way. And through this logical explanation, the behaviors seem more rational. Reaction formation is the conversion of painful or unwanted thoughts or feelings, or socially unacceptable thoughts or feelings, into the opposite impulse. So say, for example, a husband is unhappy with his wife. He's not capable of expressing the negative emotion, so the reaction formation defense mechanism is expressed, and he's overly kind and generous. So he's moving in the opposite direction of the feeling or impulse. Next we have regression. Now regression is similar to fixation. At fixation, an individual is locked, they're stuck at a stage. In regression, an individual moves to an earlier psychosexual stage of development, one that individual perceives as safer. And they take on the behaviors associated with that earlier stage of development. The next defense mechanism here in this list is repression, but I'm going to move to sublimation first and come back to repression, as repression is a fundamental defense mechanism and relates to the conscious, preconscious, and unconscious, which I'll get to in a moment. With sublimation, an impulse that is socially unacceptable is channeled into a socially acceptable activity. So an example of sublimation could be if an individual has what they consider inappropriate sexual desires. They would refocus that set of impulses into, say, their schoolwork. So they're redirecting that energy into a productive outlet that won't get them in trouble, but actually might be quite beneficial to them. To do better at schoolwork could be considered a real positive. So now moving back to repression. So let me move over here and talk about the conscious, preconscious, and unconscious. So Freud believed that the mind could be divided into 3 areas of awareness. Conscious awareness is what an individual is aware of right at the moment. It's in the forefront of their mind. Preconscious involves material that a person could bring into their conscious awareness. It's available to be moved from the preconscious area to the conscious area, but something would have to be done to trigger that. They would have to want to retrieve that information, or some stimulus could cause the retrieval of that information. So for example, if you were to ask somebody what was the name of their second grade teacher, in many cases a person could recall that information, but they weren't thinking of that before you ask. It was in their preconscious. It was available to them. They had that information, but it wasn't what they were thinking of at the moment. And then the third area of the mind, according to Freud, is the unconscious. And the unconscious contains material that a person cannot directly access. It can be accessed, according to Freud, through psychoanalytic therapy and the different techniques that he proposed, but it can't be directly accessed. A person can't access it in the same way they would access the name of their second grade teacher. Individuals are unaware of the material in their unconscious mind. So what does that have to do with repression? Well, repression is when the mind takes material from the conscious area or the preconscious area and pushes it into the unconscious. It represses the material. It moves it into the unconscious mind and therefore makes the material not accessible to the individual. And the reason why repression is fundamental is because, in a way, it is the goal of all defense mechanisms. All defense mechanisms have a repression component to them. So as I mentioned earlier, Freud believed that the utilization of defense mechanisms could reduce anxiety. But if the ego overused defense mechanisms, it could cause dysfunction. And depending on defense mechanisms to relieve anxiety keeps the conflict from being resolved, keeps the conflict unresolved. And, if left untreated, could expand from anxiety to panic and to phobias. So an individual has this anxiety because of an unresolved conflict. The defense mechanisms seem to help a little bit for a while. The ego over-relies on those defense mechanisms. And then, in addition to anxiety, the person could develop panic and phobia. As I mentioned when reviewing the defense mechanisms for fixation and for aggression, we need to be aware of the psychosexual stages of development. And here they are. According to Freud, there are 5 stages. So for each of these stages, Freud believed that the id's sexual energy, the libido, is focused on the corresponding part of the body. And if there is an over or under gratification of the sexual needs during that stage, it leads to specific personality types or characteristics. So first there's the oral stage, which goes from birth to about 1.5 years. Then the anal stage, which goes from 1.5 to 3 years. The phallic stage, 3 to 6 years. And it's during this stage, the phallic stage, when Freud proposed that the Oedipus and Electra complexes were a potential factor. The Oedipus complex was where a son would develop sexual desires for a mother, and the Electra complex is where a daughter would develop sexual desires for the father. Next we have the latency stage, and this goes from about 6 years to puberty. And according to Freud, no psychosexual development occurs during this stage. The libido is not active, but rather the sexual energy is sublimated into activities like recreation, relationships, school. So during this stage, a child would develop new skills and learn new information and develop relationships. The last stage of psychosexual development is the genital stage, and here Freud believed that an adolescent would engage in sexual experimentation, and if they successfully resolved the conflicts of the stage, they would end up in a romantic relationship. The age range here is puberty to adult. Freud thought of adult as somebody in their early 20s. So as you can see, his stages really don't cover the human lifespan. They just go from birth to early 20s, which is one of many reasons why many don't accept the psychosexual stages as the accurate representation of human development. So moving from theory of personality to the causation of symptoms. What causes symptoms in the psychoanalytic model? And it comes down to unresolved, unconscious conflicts. It's worth noting that these conflicts, according to Freud, occur as a child. So what happened to a client as a child is going to be a major focus of a psychoanalyst. Moving on to techniques. So the first one I have here is catharsis. And this is a release of emotions or emotional energy in an effort to relieve symptoms. Catharsis is common to many theories of counseling, not just psychoanalysis. Next we have dreams. And Freud really emphasized the value of dreams and dream interpretation. He believed that you could see unconscious material by analyzing dreams. Similarly, he believed through free association that you could see unconscious material, that it would come to the surface. And free association is where a client simply says whatever comes to their mind. Freud believed that when unconscious material is brought up, commonly clients would exhibit resistance. It's uncomfortable and painful to have these anxiety-provoking bits of information come to the surface, and resistance was a way of slowing this process down or stopping the process. He believed the value was in the analysis of the resistance. He also believed in analyzing transference. And like catharsis, transference is a term that we use across many different theories of counseling. And this is when a client projects feelings onto a counselor that were originally formed and focused on another important individual in that client's life. Freud considered transference a type of resistance. Now, this is a good opportunity to bring up the concept of countertransference. In psychoanalytic therapy, transference is considered important, useful, and analyzing transference is one of the techniques. Countertransference is when a counselor projects feelings onto a client, and this is considered destructive. And one of the ways that a counselor can avoid countertransferring is to have good self-awareness. So looking here on the right, under techniques, when a client comes in to a psychoanalyst, the psychoanalyst is going to ask questions about their motivation for treatment. So what symptoms are there that they want treated? Attempt to build a therapeutic relationship. Explore the various areas of concern the client has. Confront the client in a helpful way to enable the client to see impulses, feelings, emotions, and behaviors from a new perspective. The counselor will try to interpret current behavior that's not healthy and connect it to potential unconscious material. And in the last stage, working through, the counselor will help the client integrate insights that were discovered through the course of the counseling. So what are the goals in psychoanalytic therapy? Well, one goal is to bring unconscious material into the conscious mind. For example, through techniques like free association and the analysis of dreams. Another goal is to develop insight into unconscious processes, including those that were at work when that material was pushed down into the unconscious. Another goal is to resolve internal conflicts, reintegrate repressed material into the client's personality, and reconstruct the basic personality. So now for the last section, I'm going to offer my opinions about the usefulness of psychoanalytic therapy. And keep in mind, these are just my opinions. There are counselors that primarily use psychoanalytic therapy, although it's not a particularly popular modality. It is still practiced. But of course, as you can imagine, some of the concepts proposed by Freud have been rejected by a great number of counselors. But that doesn't mean there aren't certain concepts that he brought forward that cannot be used productively in counseling. For example, the idea of the unconscious, the first item I have here. There are many opinions about what the unconscious really is. There's opinions regarding whether it really exists or not, and if it does exist, what is its true nature. But regardless of one's thoughts about the unconscious and what it may be, the concept of the unconscious, the concept that a client comes into therapy and may have this area of their mind where material is stored and that material is difficult to access, can be a particularly useful concept when treating clients, even if one is integrating the concepts of psychoanalytic therapy into their own integrative counseling model. And this is what we often do as counseling practitioners. We take bits and pieces of different theories and we put them together, we integrate them into a theory that we use. And I believe the unconscious, the idea of the unconscious, is an important contribution that can be integrated fairly well into a lot of different types of counseling modalities. Another construct that I think is useful is the idea of unresolved conflict. Now, of course, looking at it from the Freudian point of view, the unresolved conflict was always in childhood and of course followed the rules of psychoanalytic thought. But again, the idea of unresolved conflict, regardless of what it means in psychoanalytic thought versus other modalities, this idea of unresolved conflict can be useful. The idea that a client comes in and there's some conflict that occurred in their life that is just not rectified. It's just not balanced. It hasn't been worked out yet. This is a particularly valuable concept in my opinion. The next item, fixation at a stage of development. This, I think, is a useful concept in general counseling, again, regardless of the modality. Now, the psychosexual stages have largely been rejected, and I don't believe they're a useful stage model. But the idea that somebody can become stuck at a stage of development, I think, is a useful tool. We often hear in relation to counseling the word stuck, that clients become stuck at a certain point. And our job is to facilitate getting them unstuck. And I think that's really referring to fixation at a stage of development, at least in many of the cases. And for that matter, we can see evidence of many of the defense mechanisms when working with clients. And I think it can be helpful to recognize these defense mechanisms even if we don't necessarily believe the psychoanalytic explanation for that behavior. I still believe that pointing them out can lead to insight. And that brings me to the next item, which is insight. And insight is part of the psychoanalytic model. And it's actually a crucial part for the working through stage, which is the final stage. The idea of insight, of helping clients develop insight into their thoughts, feelings, and behaviors, is seen in many of the theories of counseling, and is not specific to just psychoanalytic therapy. Arguably, insight is one of the most important concepts that we can take from psychoanalytic therapy and use in our integrative counseling modality, if in fact we use integrative counseling, which many counselors do. And the last item is transference. Transference is something that we see when working with clients, and it is a concept, again, that we see in many theories of counseling. I think it's useful to understand transference. I think it's useful in many cases to point out when transference is occurring, and to help clients understand why it might be occurring. And I think, along with transference, a really valuable takeaway from psychoanalytic therapy is the concept of countertransference. Countertransference being something we should work diligently to avoid. And in order to do that, we have to recognize that it's real, that it exists, and that it does happen. That it's not healthy for therapy, and that we are capable of understanding ourselves, of being aware of ourselves as counselors, and avoiding countertransference. Incidentally, the concepts of insight and transference and countertransference are also important to understand when providing clinical supervision to counselors. So to summarize psychoanalytic therapy, it is a controversial therapy in many ways, but it offered us a lot of specific items that we use very often in modern counseling practice. I hope you found this video on psychoanalytic therapy to be useful. As always, if you have any questions or concerns, feel free to contact me, and I'll be happy to assist you.